Today we have a case of a complete ACL tear and medial meniscus complex tear involving posterior horn and the body. Hello, I am Dr. Prateek Joshi. Today I am going to show arthroscopic ACL reconstruction and partial meniscectomy. So you can see that we are in medial compartment. There is also MCL injury. So you can see that the medial joint space is quite huge, which you don't see normally when the MCL is intact. And you can see that I am evaluating the medial meniscus, posterior horn and body tear with the arthroscopic probe. It's predominantly horizontal tear. You can see there is a superior lamina and the inferior lamina. So in this case, ideally we should repair this kind of tear, but the patient has been explained about the repairing of the meniscus, but he unfortunately is not able to afford this procedure. So we are going to do arthroscopic partial meniscectomy in this patient. So I'm going to remove only the portion of the meniscus which is unstable so that it doesn't come in the joint space while bending the knee. So you can see that I am removing the unstable portion of the meniscus with arthroscopic punch, and once I am done removing this portion of the meniscus, I am going to use my arthroscopic shaver. By the way, if you like this kind of videos, do like and share the video and subscribe to the channel. Your support is highly appreciated. So now I'm going to remove all this torn meniscus tissue with the help of arthroscopic shaver. So the meniscus looks stable. I don't want to remove too much of the meniscus tissue because that will be detrimental to the health of the medial compartment of the knee. Now moving towards the ACL reconstruction, you can see that I have introduced my femoral aiming device from the anteromedial portal, and I have engaged it posterior to the lateral femoral condyle, and I am going to drill my guide wire through the femoral aimer in the lateral femoral condyle. Now I'm going to use end overturn drill bit to drill over the guide wire to create the femoral ACL tunnel. Now I'm going to drill with 8 millimeter drill bit over the guide wire up to mark of 30 millimeter. This is the tunnel how it looks from the anteromedial portal. You can see there is no blowout. Now I'm going to use tibial ACL jig to drill my guide wire through the ACL stump in the tibia. And now I'm going to drill over the guide wire with the 9 millimeter drill bit. After this we have passed the graft and flipped the button, and we have fixed the graft at the tibial end with interference screw. And this is the final picture of the graft as seen through the anterolateral portal. You can see the location of the graft is anatomical and it is quite strong and robust, and this is going to provide good rotational as well as anterior stability to this knee joint. This is the graft as seen through the anteromedial portal. You can see that it's in anatomical position and it's quite strong, so that should be enough to provide good stability and good functional recovery in this patient. Now we are going to do MCL repair after this, and this is going to provide complete stability in this patient, and we are going to start rehab straight away from the second day of the surgery. Thank you. You can see that there is grade 3 anterior draw test which signifies complete ACL tear, and this is the video after the ACL reconstruction. You can see that the instability has completely disappeared. And this is the video of MCL laxity. You can see there is grade 3 valgus stress test positive, and we have done MCL repair with 5 titanium anchor, and you can clearly see that the MCL stability has been restored. Thank you.